Hi, this is Dr. Vivek Sasindran and welcome to yet another episode of ENT Talks. We will be continuing with our series of talks on common ENT procedures, OPD based procedures or daycare procedures. So today I would be talking about earlobe repair. Well, it's a very common condition that we come across in people who wear ear studs, earrings. Now what happens over a period of time is that the earlobe tends to sag, the hole becomes bigger, and subsequently the patients may not be able to use earrings. So what is generally done for these patients is under local anesthesia, we can just freshen the edges of the opening and subsequently suture the entire opening. And once the opening closes off, we can take away the sutures. Now this is the simplest way of repairing it. But what we need to understand is, however good your repair is, subsequently if you have or if you tend to use heavy earrings, these are bound to sag again. So it would be a good practice once if you have had a earlobe repair to use smaller studs. Now something that has become more fashionable is the use of adhesive materials to seal the perforations, to seal these openings. And these are generally not done by the trained medical people. These are generally done in beauty parlors and so on. So what we need to understand is that if these kind of tissue adhesives come in contact with raw skin, there is chance of significant tissue damage, skin loss, and very bad scarring. So one needs to be very careful before opting for such options for earlobe repair. Thank you.